Just the other day, in fact, we had a patient that was seen in our medical clinic for a separate issue, but they were complaining of tooth pain, and subsequently the provider was able to come over and just talk to me in my office and explain the situation, and we were actually able to get the patient scheduled that day to treat the patient. The patient was very grateful, she was very appreciative, and that's how it works around here.
Hi, I'm Peg Hopkins. I'm the CEO of the Community Health Association of Spokane, known as CHAS. We started the Community Health Association in 1994 with a $45,000 planning grant from the Bureau of Primary Health Care and 2 exam rooms.
But community health, I guess, this is where I grew up, I would have to say. I mean, this is, if I was a kid, this is where I would have went to the doctor if we went. So I think it's a way to maybe give back after getting an education.
Really, I come to work each day, for the most part, really feeling like I'm doing what I set out to do as a doctor in a community health setting, and that's exciting to me.
I just enjoyed healthcare, and I liked being part of patients' healthcare, so I decided to go into pharmacy. And then once in pharmacy, I really liked the clinic style setting where you can work hand in hand with the doctor and know a patient completely and not know just the medications.
I enjoy working here at CHAS, in a community health center, because we get to provide health services, particularly dental services, to uninsured patients and underinsured patients, patients that otherwise wouldn't be able to receive these services, and we're able to provide that care to these patients.
Having them co-located with medical pharmacy is wonderful. I get to work with my medical colleagues a lot more. We discuss issues that come up. If I have a patient that I'm concerned about some health problems, I can get them in on the medical side right away, and we can get those things addressed so that they're being cared for as a whole person. And that's the idea of what we call a healthcare home.
In my first year or 2 here at CHAS, I saw a real need for treatment for hepatitis C, people with this chronic infection, and it was a need that wasn't being met in the community. How it kind of took flight is I went to administration here and told them that we really needed to provide this service for our patients, and I was really impressed by how quickly and completely the idea was supported.
We also have our pharmacist-ran anticoagulation clinic, which again is another specialty function that our pharmacists can provide to enhance that safety and management for patients that require anticoagulation treatment. Our providers refer into our system, and our pharmacists are able to manage the patients with their warfarin therapy through that program.
We're known throughout the country for our leadership in electronic health records and all things related to appropriate technology for health delivery and wellness. If you put the right people on the mission and you work hard together, there are solutions to creating universal access for all Americans. We're doing it here every day. And we learn something new every day, and that's what keeps me coming every day.
I come to work every day probably for that chance to make an impact. I mean, I have patients, and you look forward to seeing them and hearing their story. Sometimes you refill a medicine, but that's the least of what you do with a visit. It's listening about their grandkids or their kids or their new job or maybe the loss of a job sometimes. It's more of that than I think always just handing out a prescription.
Where a lot of diversity, so you learn different experiences from different people.
CHAS means a great place to work. I enjoy coming to work every day. I get to work with an awesome team of healthcare professionals, as well as treat a great group of patients.
Working at CHAS is a great opportunity, and I feel just so blessed to be here in terms of being part of that team. Practically every day you'll run into people in the community in the medical field that find out where I work, and it's interesting because they'll always say, "Wow, you guys do such a great job there." Makes it worthwhile.
Community health centers are enjoying a lot of popularity right now because of the good work that they do in all the communities that they serve.